That's one of the things I like about what we're doing together is in ShareCare, you can get the best content and know that it's been vetted by the real experts, physicians, pharmacists, nurses, people who have dedicated their lives to making sure they know exactly what to do. And then we can combine them with really this next generation of coaches and influencers that we find through our algorithms. Right. So, with diabetes, for example, we can go out and say, here are the top 50 people in order who are driving share of conversation online. And those people have an outsized influence in getting the right content to people. Yep. So we can actually make a difference in how we deal and treat with diabetes, for example.
Yep. And as you think about experts online, I saw a stat that the average doctor is Googled 76 times per month. And and at the same time, you almost feel like these doctors that are in such high demand, the consumers looking for the expert, are just not digitally armed to have impact.
Right.
And the consumer expectation has gotten so high because of things like the iPad and Facebook that they expect a lot out of a website. And it's almost impossible for these doctors and health organizations to provide the utility necessary to meet that expectation.
Yeah.
And that was kind of the goal with ShareCare, is how do we become that kind of humble host on behalf of those partners and say, we'll develop the world-class technology in partnership with market leaders like WCG. We'll work on world-class partnerships so that we can bring all these organizations together so that all boats rise with the tide. But ultimately what we're trying to do is, through that world-class technology and through those world-class partnerships, is inspire world-class digital caregiving. And ultimately that's how we think we can start to reverse those numbers of chronic disease increasing.
And when I think about what we're doing, I think of it in very simple terms. I've always been extremely impressed by physicians and nurses and how people treat you when you go into a doctor's office. They're extremely clear on what you need to do, and they absolutely care about making sure that it's precise and it's the right result. And then you leave that office and you go into this craziness of online. And really what we're doing is we're extending that office visit to make sure that you continue to get the best care and the best information, so you really can continue to get the best health outcome. And that's the big opportunity here. I totally agree with you on that.